যে সিস্টেমিক হাইপারটেনশন আর ডায়াবেটিসের উপর কিডনি হেলথের এফেক্ট কেনেকে পড়ে
তো ক্রনিক কিডনি ডিজিজৰ কাৰণে যেটো টু মোস্ট কজেটিভ ফ্যাক্টৰস হয় এটো হয় হাইপাৰটেনশন এণ্ড ডায়াবেটিস।
আমার আর কি সিরিয়াস হেলথ কন্ডিশনস হয়ে যাব পারে অ্যাজ আ রিজাল্ট অফ লাইক সিম্পল প্রবলেমস সাচ এজ ডিহাইড্রেশন এন্ড এভরিথিং হোয়াট কুড ইট লিড টু?
Severe episode of dehydration can lead to something called as acute kidney injury.
What is the prostate gland and how important it is for men?
So prostate gland is a walnut-shaped gland which is situated just below the bladder and it encircles the urethra.
What are the important lifestyle changes to the মানুষ adapt করবো so that they can have a healthy prostate?
As far the healthy prostate is gone, it's not very different from what we categorize as a healthy lifestyle. That includes healthy diet, regular exercises.
Low testosterone, can it be a risk factor for erectile dysfunction? And what are the other signs and symptoms of low testosterone?
Low testosterone is one of the most common causes in the younger age group, less than 45 or 50 year age group, where we see this.
Hello everyone, this is Dr. Mayurakshi Rekha and today we are going to have a very important discussion regarding urology and andrology. So I myself as a doctor get asked a lot of questions regarding these topics and today we have renowned Dr. Barun Kumar sir to answer these questions for all of you.
Namaskar.
The first question that I would like to ask is that many people get confused about what is a urologist and who is an andrologist. So whom should we seek help from in our matters? So what do you have to say about that?
Okay, so a urologist is someone who looks over the urological health. That includes your kidneys, the bladder, prostate, and that also includes the male external genitalias. An andrologist is someone who is focused on the male sexual and reproductive health. That includes sexual health, that includes problems with erection, timing, problems with infertility as well. That also deals with male encountering with hormonal issues, that includes low testosterone or an excess of female hormones as well. So it's kind of an overlapping branch, as in most of the urologists are also trained in andrologists, and also urologists have some exposure over female sexual health issues as well, because most of these sexual health issues are related to hormonal or psychological barriers. So a reproductive health disorder should be referred to an andrologist. Someone has a specialty in it, and anyone who has a urinary problem, stone problem, and other kidney diseases can refer to someone as plain urologist or simple urologist as well.
Thank you, sir. So, sir, my second question to you would be that have you encountered any particular case which is very challenging, something about the insights that could help us learn a little more about it?
Okay, so I've been practicing urology for more than 7 years now. That doesn't include my training in residency, then overall clinical exposure, which is more than 10 years, 10 to 15 years. The most common thing which I see is something called as late presentation of a disease, which is either missed because the lack of knowledge about the symptoms, that this can be due to this issue, or sometimes due to just ignorance, that this is just a simple issue, it won't cause something serious, and most of these patients present at a very later stage. Like for example, someone with a kidney stone only presenting when the stones are of very big size or already damaged the kidneys, or presenting with either blood in urine or some high-grade infection. Someone with a prostate problem only presenting when the urine has completely stopped and not has presented to us when the problem has actually started, or even when it was in the intermediate stage. Then for example, someone having a kidney disease only coming to us when the creatinine is very high and already at the stage where dialysis is needed. So all these diseases gives you something called as lag time. This lag time in which the disease is progressing in your body, and we can have some preventive measures either to slow down or completely cure this disease. So this is something which is lacking in our society as a whole, maybe about the health education or the lack of awareness about the symptoms.
Thank you so much, sir, for your answer. I'm sure these would help people to focus on their symptoms a little earlier. That would help them in the future. So I, as a doctor, think that most people tend to overlook urine as an important health indicator. So what do you have to say about this, sir?
So urine, first we have to talk about the quantity. So there is something called as polyuria, oliguria, and sometimes more urine is also a sign of disease, less urine is also a sign of disease. Then we can talk about the quality, as in how it is coming out. So urine color, as we have talked about previously in our videos as well, urine color is a very good indicator of your dehydration, some baseline diseases. Like the ideal color should be either clear or very light yellow. Other than that, it can have blood in urine, which is called as hematuria. It can be whitish or milkish, which is called as pyuria, which can be a sign of infection as well. Then about how many times you have to go to urine and about the flow. Like if your flow is very less, it can indicate prostatic disease or some bladder health issues. There is something called as urethral strictures. These are all signs of early diseases and different health issues which can be just assessed by the quantity, quality, and the flow of urine. We can get to know about so many things.
Thank you so much, sir, for your answer. I'm sure the way sir is presenting the answer in such a to-the-point manner, it is going to help a lot of people. So for the next question, Janibo Bisarim, does the smell of urine mean something? Like, is it a strong indicator regarding any health issue?
Yeah, of course, smell to both ketama information dibo pare that smell to ideally hobo na lage. The properly hydrated person's urine will be clear in color and non-smelly. So, jodi especially pungent is smell to ahi ase, it can be a sign of a dehydrated urine. And if it is very foul smelling, like fish odor, it can be due to infection. Other than that, in some cases, we call as ketonuria, in which the smell is very fruity or sweetish. Then in that case, it can be a sign of diabetes, high blood sugar as well.
Okay, so that was a very important answer. And moving on to the next question. So next question is a very simple one. Apunar mote, how many times should a healthy individual urinate in a day?
So I mean, sobar karone eta frequency to kobo noari. Ebar bacha karone belek hobo. Someone who is 60 kgs, etu karone belek hobo. Someone who is 80 or 90 kgs, etu karone belek hobo. But jete ami mane an umbrella statement to diu, etu for an adult who is around 60 to 70 kgs. For adult who is around 60 to 70 kgs, an ideal frequency is something around 6 to 8 times. যদি তার থেকে বেশি হয়ে আসে তার মানে একটু কিবা প্রবলেম হব পারে বা তো ফ্লো টু কমপ্লিট হওয়া নাই বা কমপ্লিটলি ওলাব পারা নাই বা something called as overactive bladder in which the bladder has lost its storage capacity ধৰিব নোৱাৰে বাৰি বাৰি যাব লাগে কন্ট্ৰোলিং পাৱাৰটো কমি যায় এনেকুৱা হ'ব পাৰে যদি ওভাৰঅল কন্ট্ৰোলটো আছে কিন্তু ওভাৰঅল এমাউন্টটো কমি গ'ল that is a sign of oliguria which can be a sign of early kidney diseases as well.
Okay, thank you so much, sir. I think the answer was really appropriate for all of the audience around. Okay, sir, for the next question, there are many individuals jone nijer urine to bahut deri hold kore aru logote dehydrated thake. So hydration and holding of urine, what are the significance in the urine health?
So hydration to ami ketaman already koisu hydration is very important for overall kidney and urological health. So hydration or jeto amar rule of thumb ase the urine to ideal white or light yellow color hobo laiba apnar color of urine will tell how much hydrated you are. As far as holding of urine goes, so holding occasionally jodi kori ase etu iman mane deteriorating ba disadvantageous na hoy kintu paribari jodi urine hold kora habit to ahise ba chronically kori ase ta mane bladder upor pressure to ahe. This pressure can lead to a variety of problems that includes bladder health issues, recurrent infections, stone formation, or even sometimes this pressure is transmitted to the kidneys, which is called a retrograde pressure, and that causes kidney damage. So urine hold kora as a chronic habit is not a good thing. On and off as an emergency, it can be done, but not on a regular basis.
So I hope the audience has got answers to most of the questions right now. So as we know, sir is a very renowned urologist and andrologist. So apni nijo clinical practices or dekhi pale, what do you think? What are the most common kidney diseases around today?
Okay, so chronic kidney diseases are the most common one which we see, in which the patient's creatinine level is rising, and this is a marker where the kidneys are not functioning that well. It would early sign high to urine production to komi jowa ba swelling in the bodies, especially in the legs and face. Apart from that, some uremic symptoms that includes vomiting, indigestion, and chronic acidity. তাৰ বাদ দিয়ে আমাৰ নৰ্থ ইষ্টত যিটো কমন আছে এইটো হয় ষ্টোন ডিজিজেছ ৰিনাল ষ্টোন ডিজিজেছ ইমান আনকমন নহয় আমি বহুত হাই ফ্ৰিকুৱেঞ্চিতে পাওঁ যাৰ মেইন প্ৰিন্সিপলছ কেইটামান পজিটিভ ফেক্টৰ্ছ আছে that includes improper hydration or less water intake, high salt intake in your diet, and high animal protein intake. Tar baad di Northeast is a cancer capital of the India. So all cancers have predominant in Northeast. That includes urological cancers as well. The principal risk factor is tobacco use, which is very high in Northeast, and then that causes kidney, bladder, and prostate cancer as well. Apart from that, we have seen miscellaneous issues as well. That includes neurological issues which deals with bladder problems and overall lower urinary tract symptoms. So these are overall basic categories in which we see patients.
Yeah, so ময়ো এতিয়ালৈকে যিমানেই ৱাৰ্ডছ এটেণ্ড কৰিছোঁ I have come across numerous amount of chronic kidney disease patients and to the extent like they deteriorate to their health like dialysis or dorkar pore and everything. So I hope after this podcast like people will take their urine health a lot more seriously. So by now we have come to know that how important is kidney health important to us, and so what are the specific lifestyle changes that people can adapt so that their kidneys are both better ke function korbo pare.
So overall kidney health er karone amar কেইটামান বেসিক ক্ৰাইটেৰিয়াজ আছে যেটো আমি ফলো কৰিব পাৰিম ইন ডে টু ডে লাইফ ফাৰ্ষ্ট এণ্ড ফৰমোষ্ট ইজ হাইড্ৰেশ্যন এজ উই কিপ এমফাসাইজিং ওভাৰ এণ্ড ওভাৰ সেকেন্ড ইজ salt load. What is the amount of salt you are taking in your diet? So the rule of thumb which we prescribe যেটো কোৱা যায় খাবলৈ এক্সট্ৰা নিমখটো ল'ব নালাগে as in no extra salt আমাৰ খাবৰ প্ৰিপাৰেশ্যনত যেটো গৈ আছে এইটো ওকে কিন্তু no extra. Where we take extra, we take separately with our diet, we take with junk foods, we take with carbonated drinks and all. So I mean যদি এইবিলাক avoid কৰিব পাৰি. Third hoy moderation of animal protein intake. So for a healthy individual we need 1 gram per kg body weight. As in if my weight is 60 kg I need 60 gram of protein, but if I'm taking beyond that, that is deterioration, that can deteriorate my kidneys. Fourth is the avoidance of the insulting factors. That includes tobacco and alcohol. And most of the times we use. Other than that, there are some industrial exposures as well that includes paint, lead, and other things. But as in for general population, what we call as you hydrate your kidneys, avoid extra salt, moderate your protein intake, and avoid tobacco and alcohol. That will keep your kidneys healthy and safe.
Okay, thanks a lot, sir. So, sir, by now, an important question which most of the people from the audience would want to know. Just systemic hypertension or diabetes or kidney health or effect to kenike pore?
So chronic kidney disease or karone jeto two most causative factors are. Etu hoy hypertension and diabetes. How does diabetes and hypertension have a end insult on the kidneys, on the vessels? As in the vessels get insulted and which kidney loses its nephrons and the blood supply slowly over a period of time. It won't happen in a day, but over and over, regular small insults with uncontrolled diabetes and pressure cause chronic kidney diseases and this loss of kidney function.
Thank you so much, sir, for your answer. So for now, sir, I would like to ask that how would you suggest how frequently should people have a kidney health checkup or a routine checkup done?
So routine health checkup is something which is very important and still lacking in our general population. So we cannot say as a rule of thumb for everyone, but suppose you have a risk factor, as you have a family history of diabetes, of a hypertension, you have a family history of kidney diseases, you have a family history of stone. For you, health checkup should be more frequent, at least 6 monthly, or maybe at least yearly. Suppose you are at the age of 40 and above, then you should have an annual health checkup for overall functionality because most of the chronic diseases starts to creep in at that age. Otherwise, in the younger age group, suppose 20 to 30, at least an yearly annual health checkup is something which is mandatory and should be promoted and encouraged to all the general population across all age groups, across genders, and across people who have no risk, little risk, or high risk for any diseases.
So I hope ইয়াৰ পিছত আমাৰ audience এই কথাটো আৰু বেছি seriously ল'ব and they will start taking their kidney health a lot more seriously. So as far as the discussion has come forward, I'd like to know what are the serious repercussions মানে আমাৰ আৰু কি serious health conditions হৈ যাব পাৰে as a result of like simple problems such as dehydration and everything. What could it lead to?
Okay, so a severe episode of dehydration can lead to something called as acute kidney injury. As in, kidney to potakke body sabo pare. That can lead to overall swelling of the body, uremic symptoms, vomiting, and then the seizures as well. So this is something dehydration can cause. An episode of dehydration or chronic dehydration, as in over a long period of time, can cause you renal stones. These are the main factors in which renal stones are formed. Apart from that, you can have different electrolyte imbalances, as in something called as hyponatremia, hyperkalemia, and other micronutrient deficiencies and electrolyte deficiencies as well. So this is something, all of the parameters which dehydration can cause in extreme situations.
Okay, so I hope the episode like people will take note of the things that sir has mentioned and become more cautious and careful in their everyday life. So now, sir, I would like to ask you a very important question which most people don't know. Jay, what is the prostate gland and how important it is for men?
So prostate gland is a walnut-shaped gland which is situated just below the bladder and it encircles the urethra. Urethra is the tube which carries the urine from the bladder and it takes it out from penis. So this gland is something we all are born with. With age, it goes enlarged, which is typically starts around the age of 45-50, and then it causes a lot of symptoms that includes hesitancy, intermittency, slow urine, frequent urination, incomplete urination, and also in severe cases it can lead to complete obstruction of urine as well.
Thank you so much, sir, for your answer. So, ajikali manue juntu kotha bahut neglect kore ba overlook kore is how is the prostate gland affecting the sexual health of a person?
Okay, so prostate enlargement, as I told you, starts around the age of 45. A lot of other things are also happening around the age of 45. So at the age of 45 or 40, you're getting a lot of chronic diseases that includes diabetes, hypertension. Then your vessel health overall is also slowing down. That puts you at increased risk of cardiac illnesses and other things. Apart from that, your testosterone levels are dipping now. Okay, so this is a multitude of symptoms which are happening around the fourth decade of your life, in a man's life. So it causes a overall dip in the sexual function. Sometimes we can attribute this to the prostate gland as well, because the nerves and the vessels which are important for the penile health travels through the prostate or around the prostate. So sometimes its enlargement in infection can directly hampers the sexual health. Apart from that, there are some medical issues, right, which are happening around it. So you're taking medication for your prostate gland enlargement which are directly affecting your sexual health. So it's not a direct one-to-one causation, but it's more of everything which is happening around that time where you're having a prostate enlargement that can cause this kind of problems.
Okay. So ajikali jimani besi common hoy porise BPH is a very common problem that we have encountered in the wards. So I hope people will start taking their sexual health in a more serious way after this. So coming to the importance of prostate gland, sir, apni amak janabo paribo niki what are the important lifestyle changes to manue adapt koribo so that they can have a healthy prostate?
As for the healthy prostate is gone, it's not very different from what we categorize as a healthy lifestyle. That includes healthy diet, regular exercises, keeping an ideal healthy body weight, having a good lipid profile. Apart from that, you should have the risk factors, the insulting factors which we have discussed, that includes tobacco and alcohol. These things, if we can avoid, we can have a healthy prostate as an overall thing. Apart from that, the as we have discussed earlier, the use or importance of regular health checkups to identify the problem early and correct it at an initial stage, that can overall give you a long-term healthy prostate.
Thank you so much. So, sir, do sexual problems like erectile dysfunction, etc., indicate some other severe health problems?
Yeah. So erectile dysfunction can be due to three major causes that includes hormonal disbalances. So and most some of the times which when we see it in younger population, it is a more of an hormonal imbalance which is causing it. That includes low testosterone, sometimes diabetes, thyroid, or dyslipidemic person, or sometimes with an excess of female hormones that includes prolactin and estrogen. Apart from that, it can cause an to be a vascular issue. A vascular issue can be an early sign of an overall, poor vascular health, as in your vessels are getting narrow, so the blood supply is not proper. This can be an indicator for an early sign of a cardiac risk, as in heart risk for a cardiac event that includes heart attack and all. Sometimes it is due to some neuronal issues that can be due to systemic or local as well. So most of the times, as we discuss, these things starts happening around the fourth and fifth decade of the life. This is the time where you have also the risk factors for all these chronic illnesses, cardiovascular health, vascular health, and other things which are happening around that time. So this thing we call as this is a most early marker. An erectile patient presenting with erectile dysfunction has a 5-year or 10-year risk of cardiac event more than a contemporary of his same age who doesn't have an erectile dysfunction. So have definitely more risk of an cardiac event, something like that.
Okay, sir. So, Eto video truly, this is like an awareness that we are trying to raise because there are alarming signs, warning signs around us every time. And I hope Manhue Eto was to ignore no koro because this can have severe repercussions on your health. So now, since we are discussing about erectile dysfunction, so sir, low testosterone, can it be a risk factor for erectile dysfunction? And what are the other signs and symptoms of low testosterone in your body?
Yeah, as we discussed, low testosterone is one of the most common causes in the younger age group, as in less than 45 or 58 age group, where we see this. This generally presents with, early fatigue, poor muscle recovery, poor mood changes, bad mood changes, and then something which presents as a central obesity. You're putting on more weight than you want. That also has a milieu in the erection problem that you start getting. Your libido is less, your stamina overall, and your sexual performance has dipped down. These are all cumulative evidences of a low testosterone, which is not very uncommon. This is something which we get in as high as 30 to 40% of patients presenting with erectile problem. We get some people with low testosterone, which is also an early marker of your cardiac health, as in there have been studies which have positively shown that low testosterone values are an increased risk for cardiac health.
Okay. So I hope YouTube videos or episode people will become more aware. And if you have those signs and symptoms, do contact your physician because these might lead to severe other health conditions. So for this, sir, can you suggest some lifestyle changes so that we can prevent such problems in the future?
So testosterone boost can be done by what we call as a healthy lifestyle only. You eat well, you have a good sleep, 8 hours sleep, you take lots of vegetables and these fruits that will give you fibers and antioxidants. Apart from that, regular exercise, which is a primary boost factor for testosterone. That can include aerobics, that includes weightlifting, that can include stretching, maybe a combination of all this, which can be an overall booster for testosterone.
Thank you so much, sir. So, sir, as a young medico, I have just become an intern, not even a year yet. Something that really fascinates me right now is robotic surgery. So, can you let us know about that?
So robotic has taken the world with a storm. Uh, Initially, it was limited to, it was started in the US. This robot was initially designed to work in space, which was supposed to be, handled from here, but then it found its use in the medical health industry. So robotic surgeries are something which have given us another tool. Uh, Surgeon is the same. It's just we have some extra tools to deal with specific problems. So how does a robotic surgery works? So we have robotic arms. These are integrated with the central console, and then it is controlled with the master console, which is in the surgeon's hand. So surgeon now have the robotic camera is a 3D camera. So when it goes inside, you have a perfect 3D vision inside the body, which is a major uplift from the conventional laparoscopic surgery in which we were getting 2D vision, which doesn't allow us to perceive the depth, as in how deep a structure is. We just see that on a flat screen. So now we see it in 3D, number one. Number two is we get a robotic arm which moves in all directions and can reach most of the deep spaces. These are very long and very flexible, as in it has a certain degree of motions. It can bend at 2-3 places to reach very difficult locations, which was a major disadvantage in the laparoscopic surgery, where the instruments are straight, and then you have to they have a fulcrum effect near the port, where you have to have difficult access to the small parts, especially in pelvic surgeries, especially in cardiothoracic surgeries, and somewhere you have to have more access and more speed. So robotic surgery does help there. So especially robotic surgery, what robotic surgery has brought to the table is lesser movements.
Okay.
So those movements are very fine. It amounts to lesser bleeding and lesser pain, which is a direct advantage to the patient. Number two. Number two is access to the difficult parts, especially for pelvic surgeries. When we do prostatic surgeries and all, we have better access for suturing, for dissection and all. So it can surmount to better success rate for patients. Number three is that we just discussed 3D vision, that we get a 3D vision which is a more realistic field to surgeon. It has special use in cancer surgeries, where we have magnified access and access to the most difficult parts to get it completely corrected, and then we can repair it more quickly than the conventional laparoscopic surgeries. So robotic surgeries have definite advantages. Robotic surgeries have definite advantages over the conventional laparoscopic surgeries, but it is limited to certain specific surgeries. It's not that I have a simple condition for which I'm going for a robotic surgery. It's just another tool which is helpful in, so definitely helpful in helpful and superior in certain conditions.
Okay, so your eyes see what your mind knows.
Yeah, exactly.
Yeah, so sir is a very renowned robotic surgeon. So hey, Babe, this has inspired young minds like us to a lot of extent. So thank you so much for this, sir. So for now on, at our important question, sir, what are the risks associated with robotic surgery?
Risk. তেনেকুৱা কিবা risk নাই. Risk আমি ক'ব নোৱাৰি. In fact, it is more safer than the other surgeries that we can say. That advantage বিলাক আমি ডিছকাছে কৰিলোঁ, যে আমি 3D vision পাওঁ, আমি difficult access areas better access হ'ব পাৰে, প্লাছ আমাৰ যিটো suturing speedটো আহে সেইটো more easily, because it mimics your hand. If your wrist are moving, that instrument will move there in the same part. Like not in the laparoscopic surgery where you have to move your whole hand, and if you're moving your wrist here, it is easy. The only thing that আমি struggle কৰি আছো বৰ্তমান is about the cost thing, that it is a little bit expensive from the conventional laparoscopic surgery or open surgeries which were done in the past. But আমি মানে try to কৰি আছো completely to bridge the cost as close as possible. As of now, our costs are not as high as the cost which is for robotic surgeries in the major cities, but it's still significantly high from conventional laparoscopic or open surgeries.
Okay, so sir has really wonderfully answered to all our curious questions.
Yeah, sure.
So who is a suitable candidate for a robotic prostatectomy according to you?
Okay, so robotic prostatectomy is now we are offering for previously it was offered exclusively for cancer, prostatic cancer, which is early and localized. So যেটা আমি ডিসকাস কৰিলো যে robotic surgery gives us unique advantage for deep pelvic spaces where conventional instruments are difficult to reach. So these robotic instruments reach very easily, and then we can access the tumor portion or the healthy portion and differentiate between them more easily and more clearly. That's why it is more advantageous, especially for robotic prostatectomies, radical prostatectomies, that is for cancer. Now we are offering it to patient with huge prostates, someone with a 150 or 200 gram prostates, which we are still doing laser enucleations. We can also offer them robotic simple prostatectomies in which the same principles are used, but we go through the bladder and we removed everything. This was conventionally in the previous time, maybe 20, 30, 40 years back, it was done through open method. And then we are doing it through robotic, which is the gold standard for complete removal of the gland. So it gives you unique advantages, especially for prostate, because it's deeply situated in the pelvis, very difficult area to access through conventional instruments. So robotic instruments does give us an edge, especially for the prostate surgeries.
So talking to sir really makes me feel that a good surgeon is like a boon to the society.
Yeah.
So sir, how much is the pain associated with robotic surgery? As you have already mentioned, sir, bloodless surgeries associate korbo pare with robotic surgery. So like pain kenuka hoy tata?
Pain আমার সার্জারিতে কিয় হয়? The first point of pain is the incision. আমি কিমান কাটো যেটোতে আমাৰ access হয়। তো open surgery যিমান বহুত ডাঙৰকৈ কাটা হৈছিলে, laparoscopico আমাৰ small holes হয়, robotics আমাৰ small holes হয়। এইটো আমি keyhole surgery ক'ব পাৰিম, যেটো initially কোৱা হয়। তাৰপিছত আমাৰ next painটো হয় আমাৰ কিমান tissue handle হয়। আমি যিমান ভিতৰত টিস্যুটো হ্যান্ডেল কৰোঁ, যিমান সাৰাউণ্ডিং ষ্ট্ৰাকচাৰ্ছবিলাক টাচ হয় বা মুভমেণ্ট হয়, তাতেই যেটো ষ্টিমুলাছ ওলায়, এইটোতেই আমাৰ পেইন হয়। তো robotics দুটাতেই আমাৰ advantageous হয়. First, the incisions are smaller, 1 centimeter, ports just it, plus very refined, very small movements inside the body that creates much lesser pain than even laparoscopic surgeries. So আমার robotic surgery এইটো advantage আছে যে pain to কম হয়, bleeding to কম হয়. For patient, how it is beneficial, that post-operative recovery is very fast. As in what we expect, at least 1 day hospital stay is shorter. Rate of blood transfusion is also percentage wise very less in robotic surgeries.
So I guess most of the doubts of the people have now been cleared regarding robotic surgery, and there is nothing to be afraid of because sir has literally explained every detail in a very minute and amazing way. Okay, so as we are approaching the end of the session, so we have learned a lot about sexual health and also urology and andrology, and also about robotic surgery, and it was a very insightful conversation with sir. So thank you so much, sir, for enlightening us with your valuable words. And logote sir, yar pisot moi simple question etari a podcast to enko bisarim je how important, like how should the people focus on their health, and আৰু কিমান বেছি ৰুটিন হেল্থ চেকআপক ইম্পৰ্টেঞ্চ দিব লাগে, আৰু নিজৰ চিমটমছবোৰক ইগন'ৰ কৰা কিমান বেছি ডাঙৰ এটা ব্লাণ্ডাৰ হ'ব পাৰে তেওঁলোকৰ বাবে?
Okay. So, routine health checkup আমি যেটো মানে জাস্ট বিচাৰিলো যে আমাৰ কি এডভান্টেজ দিয়ে। আমাৰ routine health checkup আমাৰ মানে this allows us to diagnose and detect a problem which is still in its early nascent stage, where we can completely cure it before it creates a bigger problem. That is the advantage of a routine health checkup. Second, আমি যেটো problem to পাই আছো in the recent times, I don't know whether in the future will tell us whether it was a good thing or a bad thing, but most of the people are now self-diagnosing and self-medicating. As in, আমি এটা symptom পাই আছো, আমি এইটো সার্চ কৰিম কি আহিছে, তাৰপিছত নিজে এডভাইচটো মানে জাষ্ট ইণ্টাৰনেটৰ পৰা যেটো ফাৰ্ষ্ট এডভাইচ হ'ব বা ছেকেণ্ড থাৰ্ড এডভাইচ হ'ব, এইটো ফলো কৰিম, এইটো সেলফ মেডিকেশ্যন ন। Then that's the problem between information and knowledge. So this what you're getting is something called as information. So there's a lot of information, some of these are trusted, some of these are non-trusted, and then knowledge is where you have all the information and you find out what is relevant for your particular patient, and this takes years and skills and a lot of experience. So যেটু আমি regularly পাওয়া যায়, okay, some patients have actually cured minor problems by themselves at home, but we have, on the other extreme, we have many patients who have either self-medicated their pain, minor infections, which have later came to present in a very big way because they were harboring some very serious illnesses. As in someone with a uretrix, for example, for someone had a uretric stone which was found in ultrasound. Somebody, so on the internet they found that okay, these are the medications for this, so their pain initially went away. So they found okay, now I'm treated. But later it was found that actually the pain was masked by the medication, but the kidney was under pressure for a very long time, so it stopped producing urine, so that's why you're not having the pain, and ultimately the kidney is now non-functioning, it has gone. So that is the, you know, disadvantage or, you know, grave risk of self-diagnosing and self-medicating. So you should be under consultation at least, so that you should have all the information. Of course, in this age and era, our treatments are three-pronged. Whenever a patient comes, we have the responsibility to first diagnose it, okay, what your problem can be. Then we tell you the prognosis, as in what can happen and what cannot happen with your disease. And the third is we offer you treatment choices. We never decide for you like what needs to be done. So you should have all the information before you decide anything. So that's where the role of a healthcare provider comes in.
Okay, so you should not only rely on ChatGPT and Google nowadays, okay? Like,
Yeah, of course.
আজিকালি চবে চব জানে মানে চ' সেইবাবে আপোনালোকে যিমান পাৰে নিজৰ চাইন্স এণ্ড চিমটমছক প্ৰাইমেৰিলি ইম্পৰ্টেঞ্চ দিব।
Exactly.
Yeah, and তাৰপিছত it takes a lot of skill and a lot of effort. Like, it takes a lot of year to like master in all the things that
Yeah.
we doctors like go through. So please take care of your health, and if you are having any sorts of signs and symptoms, there are important people to help you, so please try and approach them. And for them, if you have any sort of urological or andrological problem associated with you, then Dr. Birun is there to help you, so do contact him.